To bring peace and love
to individuals and families
by empowering them
to live the life
they choose.
So for our mission, it really speaks to empowering consumers, empowering families.
BURD Home Health especially empowers the consumers to choose who they want to care for them.
They don't have to have a stranger in the home. They can be cared for by someone that they know and trust.
We find that for a lot of families that the institutional route may not be their best option.
If I'm sick, I want somebody that I love and who genuinely cares about me to take care of me because I know I'm getting the best care.
Keeping families together in their home and working together to make them as happy as possible.
Empowering families, that is our goal. I think it definitely brings people more of a peace of mind. It brings peace to them. I think in a lot of instances it helps them to live a longer, more fulfilling life.
So as part of our vision to modernize the delivery of self-directed care, technology plays a huge part.
Through the virtual model, we're able to streamline a lot of the administrative components of onboarding people into the program.
So we're really trying to quicken the pace to get people signed up so that their care is started quicker.
We're very forward-looking and proactive about establishing new processes and making sure that we're always ahead of the curve when it comes to both compliance and operations.
We're always trying to find that new program, that new system, that new process that works out.
We proactively communicate all changes with them. We have surveys that go out. They're well aware of any changes that may be made. We do keep that impact of any change at a minimum.
We leverage technology in order to keep our processes as streamlined as possible, allowing us to reduce that internal overhead, but we don't keep that internal overhead. We pass that on to the caregivers through higher wages.
A lot of these families have to cut their hours down at work or quit their jobs to take care of their loved ones. So we really want to try to offer them the highest possible pay we can.
Our core values drive everything that we do, and people always come before profit at BURD Home Health.
We really focus on a culture of taking ownership. Not just the leaders of the company, but everyone in the company to contribute in a way that really trickles down to the consumers and caregivers.
We're always looking to be better. We're always looking for software or stuff that we can do better internally ultimately to make it easier for the caregiver and the consumer.
We love getting the feedback from consumers and caregivers about how well the program is going in their home. We get that through reviews and testimonials and then stories from our relationship managers as well.
We really take the time to recognize the impact that we are making with our caregivers and our consumers. We love to celebrate a great review, a good feedback from a consumer, a great phone conversation, anything that we can get from them to just let us know that we are making a difference.
So I do have a consumer who calls the office every day. She doesn't talk about her care or any concerns that she has. She just calls to talk to us. She knows us by name. If she hasn't talked to somebody in a long time, she asks how they're doing. In a lot of cases, she knows our kids' names. I know her grandkids' names. And we just give her somebody to talk to every day.
It really makes you take a step back and realize kind of the good work that you're doing.
We're very close-knit. Everybody's a family. We're all working on the same path to grow our company and help as many families as we can.
We're family helping other families.
There's a lot of familiar relationships that we're comfortable relying on each other.
We're able to work fast and diligent.
We all come together as a family and figure out those roadblocks and move forward from that.
From that very first phone call that you're making to us, when you're interested in the program, looking for more information, we will be with you every step of the way. So if you ever have a question, whether it's a simple question or a complex question, there's always going to be somebody here to answer your question and kind of hold your hand through the process.